Hi Cornerstone, how are you? So great to see you. It's me, your doctor, Dr. Sabine Elize, board certified family medicine physician, CEO and co-founder of Cornerstone Medical Group. I'm here today to teach you about something new, an illness that you may be suffering from. So this is our time to learn, and this is what I love to do, to teach you so you can have a better understanding of what's going on in your body and what to look out for. So are you ready? Grab your paper, your pen, your pencil, iPhone, iPad, or whatever matter of I-ness that you have. I promise it'll be a really quick teaching and we'll hit the high yield. Here we go. So today we're talking about metabolic syndrome. Metabolic syndrome. So actually right now, the prevalence of metabolic syndrome in the United States, prevalence means the number of individuals who have metabolic syndrome right now, are 86 million people. 86 million people have metabolic syndrome right now, and the majority of them don't even know they have it. So what is metabolic syndrome? Metabolic syndrome, simply put, is when our body begins to have a diminished response to insulin. We know that our bodies produce insulin, and when someone has metabolic syndrome, well, now their body has a diminished response to it. What does that sound like to you? Yeah, diabetes. So that's correct. When someone has metabolic syndrome, that means that they are now actually on the expressway. They are on the expressway leading directly to diabetes. And it is my desire as your doctor to get you off of that expressway, find those exits so we could get you off that path to diabetes. So let's learn about that. There's actually 8 different conditions that people have or suffer from, or illnesses that they have, what we would call comorbidities that they have. And if you have 3 or more of any of these 8 comorbidities, then you're considered already alone to have metabolic syndrome. So what are those comorbidities? Number 1, and this is in no particular order. Number 1, insulin resistance. This is for someone who's pre-diabetic. Number 2, high blood pressure. Number 3, high cholesterol. Number 4, specifically for our women, it's something called polycystic ovarian syndrome. Number 5, acanthosis nigrans. This is when someone has this black kind of what looks like soot on their skin, usually in the neck, usually on the arm. That's called acanthosis nigrans. Are we on number 6 now? Number 6, there's something that's called Hair-An syndrome. And number 7 is now when someone has abdominal obesity. Abdominal obesity, if you're a man, above 40 inches around the waist. If you're a woman, above 35 inches around the waist. And then finally, coronary artery disease. So some of those things that I just mentioned of, many of them are genetic. A lot of them are genetic, but I want to talk to you about the ones that we can prevent. And the top 3 that we tend to see here in the office, or just really what we would call the bread and butter of family medicine or just your primary care office. Here are our top 3. Abdominal obesity, high cholesterol, as well as high blood pressure. Did you get that? Those are the 3 that we're going to talk about today so that we could hit, and these are your exits. This is how we exit the expressway of metabolic syndrome so we do not have to worry about diabetes. So let's talk about the first one, high blood pressure. Simply put, if you have high blood pressure, if I have given you blood pressure medication, you have to take the medication. You have to take the medication. That's the only way it works. And it's not just one day and then skip the next day. You take it consistently. And then, as you know, my goal is to get you off of these medications. And if your body can tolerate it, then we get to that point where we get off those medications. And of course, I've probably already discussed with you some of the lifestyle things to do. Particularly, we find that stress has a lot to do with people having high blood pressure. We can't have you control your stress. We can't control the amount of stress that you have, but you can control how you deal with it. And that means you have to address it correctly when it presents. If you're angry, say you're angry. Be angry. Control it, and now find a way to express it. So express it and let it go, whether that be exercising, whether that be therapy, whether that be talking to the individual, conflict resolution skills. These are all the different things that are great things that we have to think about in addition to taking our medication when it comes to high blood pressure. Number 2, high cholesterol. So high cholesterol. If I've placed you on a medication, yes, take that medication. You know we're going to be looking at those numbers regularly, depending on what it is, to see where that number has changed. And when we get to the point to get off of it, hopefully we will be able to get off of it. And then the other things that you can do yourself too when it comes to high cholesterol, you know the video's already out there in regards to some of the foods you should avoid. So you definitely want to make sure you're not having too many of the fried foods, too much of the dairy. Take that yolk out when you're having the eggs. Those are some of the things that you can do when it comes to your cholesterol. But more than anything else, high blood pressure and cholesterol, really want to take those medications. You know what I say, hit it fast, hit it hard, get rid of it so we don't have to deal with it. And now finally, abdominal obesity. Abdominal obesity. Notice I mentioned abdominal obesity because it is specific for that. We're not talking about just any obesity, abdominal obesity. So that's for you who has that Santa Claus belly. You know my family's from Haiti. We'll say that if the belly's a little big, we'll say c'est l'argent qui la donne, which means that there's money inside that belly. But more than anything else, we need that abdominal circumference to be smaller. So if you're measuring at 40 inches and you're a man, it's too much. If you're measuring at 35 inches or higher and you're a woman, it's too much. These are the things that put you on that expressway for metabolic syndrome that's leading you directly to diabetes. So what are we gonna do? We're gonna target that area in weight loss. Now, you won't a lot of times hear me talk about weight loss. I'll talk to you about exercising and doing the things you love to do as in regards to physical activity. But for this one, we're talking about weight loss. We do want you to have some weight loss, particularly at that abdomen. And a lot of times the beauty is our body's so smart. When we begin to exercise, we'll start losing the weight where we need it the most. Now, remember, I tell you this all the time. For men, our weight loss is wrapped around your physical activity. For women, our weight loss is wrapped around that kitchen. So we have to be mindful of what we're eating. We have to be mindful of how much we're eating and how often we're eating. And if this is something that I've spoken to you about and you just need a reminder, have no worries. Just give me a call. You know how to reach me. Let's set an appointment so that we could pinpoint how we could help you. Remember that medicine is not one size fits all. So what works for one person may not work for the other person. And that's why it's such a pleasure for me to be your health partner in this as your doctor as we get you to improved health as well as your optimal well-being. So that's our topic for today. It's metabolic syndrome. I hope you learned something. I hope that you could share this, and more than anything else, I hope you could put into practice what we spoke about today. So great seeing you again. I am your doctor, Dr. Sabine Elize, board-certified family medicine physician, CEO and co-founder of Cornerstone Medical Group, where we help men and women reconnect their physical, spiritual, and cognitive health to bring satisfying wholeness to their lives daily. And here in the office, we take pride in making sure we focus on illness prevention, disease treatment, and optimizing well-being. You guys have a great day. Take care. Bye.